I did a short introduction, like after years of doing this, to kind of let you know who I am. But in case you did not see that, my name is Misty Riley. I work for Mercer Health. I am a registered nurse, and I am married. I have 3 boys. My oldest is 26, and I have twins that turn 24 today. And first off, I'm just going to say I'm not an expert in any of these topics that we're going to talk about today, but I also don't think you can get to 51 years of life and not have learned something. So while I'm not an expert, I feel like I am real life, and I feel like I'm pretty practical when I talk about wellness and your health. My purpose here today is that you leave here with some information, that you learned something. But I want to, we get so bombarded with our weight and exercise that I just kind of want to bring everything together in life that affects our health. And my goal for myself and for anybody is to be able to live the life that we want to live. And to be able to do that, we have to take care of ourselves, bottom line. So, and I will just give you a heads up, like I raised 3 boys, so I feel like I might have lost my tact some along those years, because you have to be very forthright, very short and to the point, or you've lost those kids, you know what I'm saying? So and I also want to maybe give you some different ways of thinking about things, okay? So that's kind of, in a nutshell, what we're going to go through today. And Steve Worcester has volunteered to be a guest speaker. He now does weights and measures and has agreed to guess everybody's weight.
And then we get to punch him?
Yep.
Okay, let's do that. Let's go.
Well, do what you're exactly supposed to. There you go.
And the other thing about me, like, I don't like to hear myself talk, and I would love for this to be interactive. So feel free to ask questions, give comments, give your own tips, whatever. What I want to do first is, so these packets that you picked up, these are a very comprehensive know your numbers health risk assessment that you get after you've answered your questions to the health fair. So I am not going to go through this page by page, but I will tell you that you will find some good information in here. It takes all your measurements, how you answered questions, and gives you a risk number about how likely you are to develop a disease in the next 5 years, okay? So I want you to pay attention to that. It kind of gives you an indication, and the diseases it's really looking at is coronary heart disease, stroke, diabetes, and congestive heart failure. Those are the biggies. And I like it's on my page too, it talks about your modifiable risk. We're going to talk a little bit about genetics versus behaviors, but you will see that lifestyle factors play a huge part in being able to, if not prevent, delay these diseases. Okay? And then I do want to tell you too, we have talked about giving you the opportunity, if you want to sit down with your own individual report with me, setting aside like 15-minute blocks of time for you to be able to do that, and we can go over your individual reports in more depth. So that'll probably be coming maybe in July. You'll be seeing some information about that, if you're interested. I do want to just get right into some useful information here. So if you go to I don't know, it's towards the back of mine, it's like tips for reducing fat intake is what it says at the top, but it talks about fruits and vegetables, snacks, lunch and dinner. I have also, so you guys did a survey not too long ago, so I've also tried to incorporate some of those suggestions in this presentation as well. Okay, so does anybody have trouble with knowing what to eat for breakfast, for snacks, for lunch and dinner? What do you struggle with? like having it prepared, knowing what to eat. You struggle for healthy snacks. And all the above.
Yeah.
And well, I'm probably getting ahead of myself, but we're hearing a lot about protein intake too, so making sure you get enough protein. And I just wrote down some suggestions. So for breakfast, you know, you don't necessarily have to eat breakfast food for breakfast. Make a wrap, making sure you're putting lots of protein in it. You can make sheet pan eggs. I don't know if you've ever heard of that. So you make a big batch of eggs, put it in a sheet pan, put it in the oven, cut it up into 6. You can make breakfast sandwiches with it. Just throw on some ham. Roasting vegetables. Have you ever roasted vegetables? Like the older you get, I'm finding raw vegetables just don't agree. Roasting vegetables, much easier to digest. I think, in my opinion, tastes better. So that's a good way to get your veggies in. Just roast a whole sheet pan of veggies. And just a couple other things. So I don't know if you like substituting PB2 or a powdered peanut butter for peanut butter to cut down fat and calories. When you're talking about shredded cheese, use sharp cheese. You can use less and still get more flavor because of the sharp. And then when you're talking about pasta, there's lots of good alternatives out there now, like the chickpea pasta, protein pasta, and I don't know if you've ever heard of palmini noodles. I guess it's made out of palmini, I don't know. But I threw it in, I liked it like half linguine, half palmini noodles, I didn't even knew the difference. And there's like 35 calories in a serving of palmini. It's some kind of vegetable. So low carb. Anybody had them? They have them at Aldi's now too, yeah.
So Walmart too.
Yeah. So there's just some couple of quick tips there for you to use. So if you, like I said, if you want to be able to go over your report page by page with someone, be watching for that. How do I get back to that?
You just swipe back.
That way?
Yeah.
Did I do that by waving my hands?
I don't know, it was going crazy a little bit ago.
Yeah,
Thought
it's
it was him.
magical.
Okay, so the first part of this presentation is pretty much just science. We're gonna talk about all the measurements that were collected at the health fair, what they are, what they mean, and how some tips to get them in a normal range if you're not. Okay. All right, so we take your height, weight, and waist. So just, you probably already know this, but your height and weight make your BMI or your body mass index, okay? BMI, take it for what you will, it's what we've got, but it only takes into consideration height and weight. Doesn't look at muscle mass, doesn't look at age, doesn't look at gender. Waist measurement, so does anybody wonder why we do your waist measurement? So research has been done that the more weight that you carry around your midsection, the more chance you have of developing diabetes, cholesterol, heart failure, that kind of thing. If you can see this little picture right here, this is what your organs should look like. With too much visceral fat around your organs, this is what it looks like. So the reason why, so I like to know why. So why does it cause those things? And it's because that this fat secretes proteins that it can increase insulin resistance, inflame your organ tissue, and narrows your blood vessels. So it's the fat itself secreting those things to cause that damage. Foods that encourage belly fat, deep fried, processed foods, alcohol, soda, partially hydrogenated oils, and high fructose corn syrups. So that's why you need to read the labels.
I like all that.
I know, they taste so good, I know. So I will tell you, so I brought in this bag of sugar for a couple reasons. So you might not think that losing, this is 4 pounds, but you might not think that losing 4 or 5 pounds is a big deal. But think about carrying 3 or 4 of those around. I mean, obviously it's gonna be more evenly distributed, but just one of these, your body carrying this extra weight around, that's a big deal, just to lose that amount of weight. And just to share a personal, so I lost 10% of my body weight, and my cholesterol went down 60 points. My bad cholesterol went down for 50 points, and my glucose went down 14 points. So I know you harp about weight, but it really does matter. It does. And just even a small weight loss, if you need to lose weight, can make a huge difference. Okay, blood pressure. So you have two numbers of your blood pressure. There's a top number, there's a bottom number. The top number is called systolic, and that is the amount of pressure on your blood vessels when your heart is beating. Diastolic is the amount of pressure when your heart is at rest. So we get asked a lot, like, which one is more important? So the answer is they're both important, but typically the top number is used, if that continually stays elevated, is used to diagnose hypertension. And as we age, our vessels can get more rigid, and that's one reason that our blood pressures can start to creep up as we age, and we need to keep a blood count. So blood pressure is often known as the silent killer. You may not know, unless you're checking it, you may not know based on what your body is telling you that it's elevated. But left uncontrolled, it can damage your organs, can damage your eyes, cause erectile dysfunction, and cause other organ damage as well, and stroke. So it's just really something to keep an eye on and make sure you're keeping it controlled. So here's the myth. High blood pressure runs in my family, and there's nothing I can do about it. True or false?
False.
It is false. So now that's not to say you're not going to develop it, even if you do all the right things. But I just want to throw this out there this is one of the ways that I want you to maybe think a little bit differently. So yes, you have genetics, but are you also following those same learned habits and behaviors? So is your lifestyle look just like the people you got your genes from? Okay, so that you can do something about. I don't use the salt shaker, so I have no problem with sodium intake. True or false?
False.
Right. So this is another area where you need to read labels. So most of the sodium that we take in is hidden in processed foods. The recommended amount is 1,500 to 2,300 milligrams per day. And I just wanted to do a side note. So kosher salt, sea salt, is that the same as table salt? When you're counting your salt, is one better than the other? The answer is no. It counts just the same, does the same thing in your body. The only thing is, like, if you're measuring a teaspoon of table salt and a teaspoon of sea salt, you might have less in that teaspoon of sea salt because the crystals are bigger. But it still all counts the same as table salt. Just a couple other things about sea salt. So sea salt can have trace minerals in it, like magnesium, potassium, calcium. That's a good thing. But it can also have bad trace things from the ocean. So, I mean, you're getting small amounts, but those are just things to keep in mind too. I'm not saying it's bad, but the one thing they mentioned that could be is lead. So, but like I said, it's probably very small amounts. Okay. So this is a good one. So I read that red wine is good for your heart, and I can drink as much as I want. Right? So any heavy and regular use of alcohol can increase your blood pressure dramatically. It can lead to heart failure, stroke, irregular heartbeats. It can increase your triglycerides and increase cancer risk and obesity. And it's probably going to go to your belly. So obviously none is best, but 2 drinks per day for men and 1 per day for women is the max.
Can we store them up for a week?
No. So some other things you can do for your blood pressure: don't smoke, limit your caffeine, get regular exercise, and weight loss if applicable. So this is just some random things about your heart, just to let you know it is the hardest working muscle in your body. So we need to take care of it. So it's about fist size, sits in the middle of your chest, but it's tilted to the left. That's why we put our hand on the left side of our chest. A regular heartbeat for an adult is 60 to 100. And then this just kind of tells you it is pumping, let's see, close to 10,000 times a day, 2,000 gallons of blood, and you have 60,000 miles of blood vessels that it has to get that blood through. Things that can affect your heart rate: body size, age, emotions, medications, caffeine, and nicotine. Okay, glucose, or blood sugar. So we need it, our body needs it to function, but too much over time is gonna cause damage to your blood vessels and could lead to diabetes. So it can narrow your blood vessels, cause damage to your nerves, kidneys, eyes, foot problems due to poor circulation, bone and joint issues, and erectile dysfunction. So this is how diabetes is diagnosed based on numbers. Typically, it's not diagnosed off of one reading. So if you have an elevated blood sugar, your doctor is probably gonna want to do it again. And he could also do the hemoglobin A1C that is also an option at the health fair, and we'll talk about that in a minute. So the other reason that I brought this sugar is to do a little demonstration. So the recommendation for added sugar for men is 37.5 grams. Women is 25 grams. 4 grams equals 1 teaspoon of sugar. Okay. Does anybody have a favorite drink that they wanna know what's in it? I looked up some that we'll do. Okay, anybody wanna do their specific drink?
Mountain Dew is common.
What's that?
Mountain Dew is common, probably you know that.
Okay. I have a Coke. Unless you wanna Google and tell me what Mountain Dew is. I have a McDonald's medium Coke. How much sugar do you think is in that?
60 grams.
What?
60 grams is my guess.
56.
That's close.
That is 14 teaspoons of sugar. Can you measure out 14 teaspoons? And we're gonna see what that looks like in a cup. And that's probably the one that I looked up, that's one of the most, I'm not gonna say it's not bad, but a small chocolate shake from McDonald's. I'm not picking on McDonald's, that's just what I looked up. How much sugar you think is in that?
That's 14, I'm gonna say 25 teaspoons.
16.75 teaspoons. It has 500 calories in it. A Coke has 210. Anybody had a Dunkin' medium strawberry colada? I'd never heard of it, but I saw it on a commercial the other day. That has 83 grams of sugar, or 20. So is that 14?
Yep.
So this is what you're drinking in a Diet Coke, or not a Diet Coke, a Coke, a medium Coke.
Mountain Dew, a 20-ounce bottle of Mountain Dew is 19 teaspoons.
Okay, so more. That kind of puts it in perspective, right? And I'm not saying not to, but maybe not so often, or maybe find a different alternative. I just feel like that's pretty eye-opener.
Misty, do you have McDonald's sweet tea on there?
I do not.
Okay, just out of
If
curiosity.
somebody wants to Google it, go right ahead.
Probably not good. I don't drink sweet teas.
Okay, so hemoglobin A1C, that is a lab that you can purchase at the health fair. It's another one related to your blood glucose. But what it does is somehow in the hemoglobin in your blood, it can tell what your average blood sugar has been over the past 3 months. So that's a little more telling than that day at the health fair at that exact second what your blood glucose was. And then there is ranges of this as well that tells you what category you'd fall in. So normal, less than 5.7, pre-diabetic has a range, and then diabetes is 6.5 and over. So typically you don't repeat this test any more often than every 3 months because that is your lifespan. I thought that was interesting. Diabetic symptoms, fatigue, excess urination, extreme thirst, excessively hungry, weight loss. Some symptoms that you might develop if it's left after uncontrolled, vision loss, nerve disorders, especially your feet. You know, diabetics always need to keep a close eye on their feet, make sure they're inspecting it because sometimes they can't feel them. They can't tell if their shoes are rubbing a hole in their feet. The nerves have been destroyed. And you also often hear very often about amputation. It starts with the toes and then progresses. Can cause kidney damage and increases your risk for heart attack and stroke. So a couple things about some tips about your glucose. So resistance training. Why is that important for diabetes or regulating your blood sugar? Lean muscle responds better to insulin. That's why. So the more leaner muscle that you have, the better your body can control that blood glucose that you have. Even taking a 10-minute walk right after a meal can help balance your blood sugar. You want to try to prevent those glucose spikes. Okay? And also, when you eat, if you eat a protein or a healthy fat with your carb, that will prevent your blood sugar from spiking as well. So if you're going to have a piece of cake, try to eat like a string cheese before it, or if you're gonna have an apple with a piece of string cheese, like that. Just that bare sugar in your blood is going to increase your stress. Okay, here's where mental health comes in diabetes. Why does it matter? Stress hormones can increase your blood sugar. Blood sugar constantly up can lead to insulin resistance. Okay, here's a myth. Pre-diabetes always leads to diabetes. True or false?
False.
False. It doesn't have to. So your body has given you that indicator that it's having difficulties. If you can reverse some things that you're doing, change your lifestyle a little bit, if not prevent, you can at least delay it. Absolutely. Okay, cholesterol. Bear with me, I know this stuff's a little dry. So cholesterol is a waxy substance of fat that circulates in your blood. High levels can increase your risk for heart disease. I think we probably all know that. And then what happens is those deposits start to stick to the sides of your blood vessels. When that starts to happen, it's more and more likely that other things are going to stick to it. It builds, till it shuts your blood. Those deposits can also break off and form clot. And high cholesterol can be inherited, but it's also often a result of lifestyle. So there are different kinds of cholesterol. You've probably heard good cholesterol, bad cholesterol. So HDL is, and this is what it stands for, is your good cholesterol. And I always remember it because it's the happy kind, and it begins with an H. No, that's pretty scientific, isn't it?
Let's go back. Yeah.
Yep. Other way.
No, that's how you got it.
Do it again.
Oh, that's where you were.
That's where you were. Next one.
There, okay. I need to quit talking. So you actually want your high cholesterol to be as good or as high as possible, at least over 60. At least over 60. So ways to elevate that is increase your movement, balance your diet, don't smoke, watch the kind of fats that you're eating. You don't want the partially hydrogenated and saturated fats. The LDL is your bad cholesterol, and you want this to be below 100. So basically to decrease it is, basically the same as what we just talked about. So we do need some cholesterol. It's made in your liver, and we actually, it actually allows the body to make vitamin D and some of your hormones. 75% of your cholesterol is made naturally in your liver. And did you guys know that the American Academy of Pediatrics now recommends children to be tested for cholesterol because of the obesity epidemic? And they have age ranges. So if you had cholesterol in your hand, it would be like you scraped the side off of a whitish, yellowish candle. That's what it is. So the less you have of that circulating in your blood, the better. Triglycerides. So this is another kind of fat that circulates in your blood. Excess calories. Continually eating more calories than you're burning causes your triglycerides to go up. Alcohol is another big one for triglycerides. Let's see, and ideally they're less than 150. And then we have causes here, so obesity, alcohol, diabetes, sedentary lifestyle, high fat consumption, and then so ways to decrease those: exercise 30 minutes. Try to avoid sugar and refined carbs, weight loss if needed, choose healthier fats, and then here's some examples like olive oil, nuts, fish like tuna, salmon, and sardines, and increase fiber. Fiber can help get that out of your blood. If you are increasing your fiber, make sure you do it slowly to try to prevent GI issues. Okay, so the CBC, it is another test that you could have purchased. It is counting what kind of blood cells you have in your whole blood. So you have red blood cells, white blood cells, platelets. Hemoglobin and hematocrit are both part of your red blood cells. The red blood cells are important because it carries oxygen to your organs, to your brain, throughout your whole body. And this is where I say if your numbers are elevated, especially white blood cells, don't Google it. Just don't. Because look at white blood cells. So the white blood cells are all about your immune system. They are your virus, your bacteria, your invader fighters. So a cause of abnormal white blood cells can be cancer, yes, that's where our mind always goes, but it also can be a medication reaction or hard exercise. So that's why I say don't Google it, because what's your eyes gonna focus in on?
Cancer.
Cancer part.
Yeah, don't do that. Can be lots of other reasons. And then platelets are what helps your body clot, or your blood clot, sorry. C-reactive protein. So this is will show up in your blood. It's made by the liver. It increases when you have inflammation in your body. That inflammation can be caused by infection. It can be caused by arthritis. It can be caused by a knee injury. I mean, anything in your body with inflammation can cause your CRP to be elevated. And yes, it can be related to your heart as well. But just know if you do have an elevated level, it's not strictly because of your heart, and your doctor's probably going to do more testing to find out if this is elevated. Again, don't Google. PSA, so this is just for men, obviously, they have the prostate, and it can be elevated for other reasons than cancer. It can be elevated because your prostate is inflamed or enlarged. So hopefully, if you're elevated, you'll share that with your doctor. A digital rectal exam can tell if your prostate is enlarged. That's manually checking your prostate. And then I don't think that doctors recommend this for everybody, so just talk to your doctor to see if this is right for you. It can get lots of people worked up if it's elevated, especially without that digital rectal exam that goes along with it. So it can be an indicator, and more testing will be done. Okay, so thyroid. Thyroid, underactive thyroid, overactive thyroid typically affects women, but it can affect men too. The reason thyroid is important is because it really controls everything in your body. It controls your metabolism, skin and bone maintenance, mental activity, brain development. So it is important to know that your levels are in a normal range. I will also tell you that if you're at the low end of normal and still having all these symptoms, keep fighting to either get a correct dosage. There's also different kind of thyroid medications. There's Synthroid, there's also Armour Thyroid, which is a more natural form. So I'm just saying, like, be your own advocate in any area of your health. Like, if you're still having all these thyroid symptoms, and maybe you're at the low end of normal, maybe consider, talking to your doctor about bumping your levels. It is important. I mean, really, as much as it controls, it's important to get you to your ideal level. And then I just have some information up here. So we test TSH and your T4. TSH that's the thyroid stimulating hormone that causes your body to make the thyroid. And then these obviously can be either high or low, and then either condition can require medication. Vitamin D. So this is necessary to maintain strong bones and healthy tissues. You need sunlight because the body converts it to the active form to make it usable by the body. And that's why we all struggle, especially in the wintertime in this area. You can also get vitamin D in your foods. And then I have some food sources up there: salmon, tuna, mushrooms, egg yolks. And then some foods like cereals, milk, yogurts are fortified with vitamin D because your body needs vitamin D in order to absorb that calcium. That's why I was putting those foods. Symptoms of low levels: fatigue, bone pain, muscle weakness, aches, and depression. Okay, so this is where I get a little passionate. So, like I mentioned earlier, your health is way more about your weight and your physical activity. And it's a little hard to see, but I do have handouts if you want to take one. Up in that circle, it talks about the different areas of life that affect your health. So we have social, physical, spiritual, emotional, occupational, intellectual, environmental, and financial. All of those can affect how you feel. They can affect your body. It can affect your mental health. So not that these are all going to ever be completely in line, completely balanced. But this is just more to consider than how much you weigh. So now that you've done the health fair, you have your reports, you know your risks. Like if you have some abnormals, you're not feeling well, you're concerned about something, where do you start? So I always talk to your doctor, okay? Find out if your body is on a level playing field. There are so many things that can be out of balance. Is it your hormones? Are you lacking in vitamins? Are you not sleeping? is huge. That's when your body is repairing itself, restoring itself to function optimally the next day. Joint pain, or mental health, GI issues. So, I mean, let's think about a car. So we have cars, okay? We do regular maintenance. We don't wait for our car to run out of gas. We don't wait for it to break down. We give it the fuel that it needs to run. We take it every 5,000 miles to get it checked, right? Why don't we do the same thing with our bodies? Do we have a more important vehicle? It's what's getting us through life. So just like a car, your body has warning signals. Your body has indicator lights, so to speak. And your body also needs the proper fuel to run. So, sorry, maybe that's a bad analogy, but I think it's perfect. I mean, just think of how we treat other things, take care of other things versus the body, the one body that we are given to live in. Okay. Okay, so let me talk a little bit about GI health. So I am going to be pretty generic. I can't tell you what to do to fix your GI. I'm not going to recommend supplements. I'm not going to, none of that. I'm just going to talk about what could be causing it and some immediate things that you can start doing to see if it helps, okay? So number one, read food labels. The less ingredients that are in your food, the more you recognize those ingredients that are in your food, your body is going to be able to process better, okay? Food dyes, chemicals, additives, artificial flavorings, sweeteners, seed oils can all be inflammatory and wreak havoc on your GI system. What do you think are the three biggest food intolerances or biggest causes of inflammation in the body? Any ideas?
Sugar.
Sugar? Meat. And dairy. So try to pay attention to what you eat, when you eat it, how you feel when you eat it. And if you are noticing, something over and over, try to eliminate it for a while. And when I say a while, I don't mean a week or a day. I mean for a couple months and see how you feel. Maybe that's the issue. So here's for some tips for stomach upset, heartburn, bloating, and gas. So number one, slow down. Slow down your eating. Your digestion starts in your mouth because you have saliva enzymes that start breaking down that food. So the longer you keep it in your mouth, the less work your stomach is going to have to do when it gets there. Also chew. Chew to applesauce consistency. So both of those things together can also lead to you consuming less calories because we eat way too fast. I do. I'll say I eat way too fast. We just do. We're always in a hurry to do the next thing. Or we're watching TV, or we're doing two other things while we're trying to eat. So if you slow down, you might just give your body, your brain, or no, your belly, time to tell your brain that you're full. Because when you're eating fast, your body doesn't have time to get that signal, and before you know it, you are stuffed, took in way too many calories than what you even wanted or needed. So both of those things, those simple things can help with all of that. And also, don't get to the point where you're starved during the day, and then just stop eating at that first indicator that you're full. Here's a biggie. You don't have these cute cups. Drinking from a straw, bad for bloating. Every time you take a drink through that straw, you're also taking in air with your liquid. So if you have a problem with bloating, gas, that kind of thing, maybe just take your lid off and just drink from the cup and see if that helps. Okay? Simple things that everybody feels. Okay, so when you think about your health, we're all in different stages of life. We all have different concerns. We all have different histories. What is the one thing that bothers or worries you the most? What do you think about? What do you stress about? Beat yourself up about the most? Not what you think you should change, but what takes up the most space in your head? What causes you to get overwhelmed, anxious, depressed? What you overthink or obsess about? This is where it gets really direct. So acknowledge that if you want something to change, you've got to change. You've got to make changes. And I said, we all know the definition of insanity, right? Keep doing the same thing and expect different results. So whatever stage of life you're in, you can make positive changes. You know, I've been through the stage of, raising kids, that chaos. I've had 3 kids under the age of 3. I had twins. Then you go through all the sports, and then maybe you go through marriage struggles. Maybe you go through financial struggles. There's something that you can do to help with whatever's bothering you. And it can just be something small. Start with something small. But you have to be willing to be open-minded, to try something different, and maybe a little uncomfortable at first. Okay, so be real and honest with yourself. Do you really know how little you're sleeping? Do you know how much you're eating? Do you know, this is a big one, do you know how much time you're wasting on your phone? And there's actually settings on your phone that will tell you that, how much time you spend on social media. And you can also set goals for yourself and it'll beep at you if you go over that goal. I think if you look to see how much time you spent on social media, you might be a little shocked. So the average person per day spends 106 hours per year. Average person per year, 706 hours. That's 112 days we wasted on social media. That's TV. 2,700 hours on TV. That's 112 days. So we think we don't have time. It's just about where we prioritize and what we've moved to the top of our to-do list. Sleep. Sleep affects insulin resistance, your mood, your memory, your focus, your hunger hormones, decision-making, activity. This plays a huge role in your mental health. We do this sleep challenge, and I see people turn in their papers that say they sleep 7, 8, 9 hours, and I am so jealous. Like, menopause is real. It is terrible, and I want to sleep so bad, and sometimes it's just difficult. So talk to your doctor, see what you can do. I did say I'm not going to tell you about supplements, but I did find a magnesium that has helped me. But again, you've got to talk to your doctor and see what can help. Because if you're not sleeping, it's like trying to fill a draining bathtub and anything else that you do with your health. Here's a tip. Keep your bedroom at 65 to 68 degrees. That's been found to be the ideal temperature for sleep. Phone, put it away at least an hour before bed. Scrolling, it's an addiction. It makes it impossible to shut your mind down. We always have some kind of stimulation, whether it's on our phones, whether it's the TV. Our minds just need time to rest in order for it to shut down and go to sleep. The other thing about this is that, and I'm not picking on social media, I'm an addict, I do it too, but I know that it can be detrimental to mental health. So if you find yourself struggling in any of these areas, these are just some tips to try to help. Do you find yourself watching others live their lives more than you're living your own? Find healthier habits, healthier hobbies. Calories and protein. So have you ever tried, so if this is an area where you struggle, don't really know what you're eating, have you ever tried tracking? So there are apps out there that can help you figure out how many calories you're consuming and then break it down by macros. Macros meaning macronutrients, protein, carbs, fat. It's not for everybody, but even I think if you do it for a couple days, it can be very eye-opening of where you're spending your calories. Movement. So if you're, pretty sedentary, start small. Set a small goal and just focus on that. So what I'm really thinking is find out what bothers you the most, start there, give yourself a small goal, and work from there. And we talked about why resistance training is helpful for your blood sugar, but it can also is helpful for maintaining your muscle, because as we age, that's another thing that goes downhill, is your muscle mass. Do what you need to do. You can use an app, you can use YouTube for exercise videos, get outside, find an accountability partner. Consistency is the key. Okay, here I just want to talk a little bit about food labels. So I did have a comparison up here. So yogurt is a biggie. Have you ever looked at the food labels on yogurt? Who eats yogurt in here? Okay. So let me get out my paper because there's a comparison on the next page. So this is just a regular yogurt. It has 170 calories. It has 26 grams of sugar in it. It has all these strange ingredients that we don't really know what it's for. I guess my Greek yogurt's not up there. Okay, so I had this compared to Greek yogurt. They were both 170 calories. This had 26 grams of sugar. The Greek yogurt had 0 added sugar. This has 5 grams of protein in it. The Greek yogurt has 25 grams of protein. So that's why it's important to eat. And they tout this as healthy, 99% fat-free, low-fat yogurt. But then this is why you need to look at the food labels and compare. Protein bars are another one. So did you know that if you're trying to be calorie conscious and you're trying to get enough protein in, so for the biggest bang for your buck, if you take how much protein is in something and put a 0 on the end of it, that is about how many calories should be in your product. So according to this, it should be about 50 calories. It's 170. On this Greek yogurt, so it has 25, so it should be 250 calories, but it's only 170. So that Greek yogurt is by far, for many reasons, the best alternative. Yes, it's gonna be more expensive, but have you ever wondered why this is so cheap? It's probably because it's got a lot of crap in it. So cheap isn't always best. Okay, so just read, compare. Protein bars is another one that you will find lots of ends of the spectrum on. So just make sure you're getting the biggest bang for your calorie buck. Okay. So if this was also easy, why can't we? Why am I not 120 pounds? Why do I not have $1 million in the bank? Why, why? It's so easy, why? Because it's not easy. I'm sure you've heard this before, is to develop your why. Why do you want to make these changes in your life? What drives you? What is going to give you that internal motivation that when all the external things that you follow, all the external things that you're reading fail? It's because you have this powerful, purpose-driven motivation. So I think that is where you start. And you have to dig deep sometimes. But there are so many benefits to living with a purpose. It is easy to get off track, to lose your focus if you don't know where you're going, why you're doing it, and how you're going to get there. So with that purpose-driven life, you're going to build resilience. You're going to stay focused, you're going to build confidence, life is gonna look like an adventure because you're living and working towards the life you wanna live. And it's just, that's where I think you should start. If something is just not quite right, you want something to be better, I think keeping up with the Joneses is killing us. We're comparing our kids, we're comparing our finances, we're comparing our possessions. And now it's not only, looking at your next door neighbor, you've got all these people on social media that you're comparing yourself to. But is that really the life that you want to have? So figure out what that is, live the best life possible, and take care of yourself so that you can do it. Any questions? Under pressure? So if you guys ever have any questions, please feel free to contact me. The handouts that I had are just going into a little bit more detail of all those elements of wellness. There's some tips on there, a little about why they're important. So yeah, I'm here to answer any questions you have. And that's it.
Dismissed.
Thank you. Thank you. We'll see if they show that on it.
Karen, look there too.